let's talk about MART. Well, this video is more of a ramble and a rant rather than the facts which we speak about on most cases, which are mostly taken from GINA guidelines. This formoterol, this long-acting beta agonist, had a very unique character which was discovered in way back in 1960s. It was just not a long-acting beta agonist; it was a rapidly acting beta agonist, giving competition to salbutamol in its action. The manufacturers took good few decades to put this salmeterol and inhaled corticosteroids in a single inhaler and give it to the masses. Over time, this has become a revolution. The terminology, maintenance and reliever therapy, MART, though it was introduced quite early in early 2000s, it became more and more popular from 2014 and onwards. Gina has been quietly pushing it to the masses, quietly pushing it to the practitioners, and it has revolutionized the entire management of asthma over years. The initial MART therapy or the initial in ICS formoterol combination came with 200 mics of budesonide and 6 microgram of formoterol. Majority of the studies what we have in our practices are limited to this combination. Since 100 micrograms of budesonide and also 6 micrograms of formoterol is in the market, a lot of that is also being pushed into the pediatric age group. We are getting more and more evidence in the years to come, which is ongoing. The research is ongoing. Of course, we will get the results in due course of time. Why this SMART has become such a revolution? Quite naturally, you have just one canister, one track, one step to follow. You don't have to scratch your head. You don't have to find another device. You don't have to find another inhaler. For just not for the maintenance, but also in case you have any emergency, you have any distress, you have to go to exercise. For all these factors, this becomes such a simple and an easy device to recommend to anybody who is having asthma. For instance, if you take the ICS formoterol combination has been able to bring down the emergency visits by 65%. Isn't it amazing to see just one drug is able to do that much? Just not that, it has been proved that we will be able to achieve higher benefit with a lesser dose of inhaled corticosteroids given as a combination. That means it is having that steroids sparing effect. And all that fear of giving more and more steroid is gone when you are giving ICS with formoterol. This is the beauty of this drug. So we, all the as I've been talking, majority of the recommendations are for patients who are taking 200 of budesonide and 6 micrograms of formoterol. The emerging evidence is also there for beclomethasone, fluticasone, and 100 micrograms of budesonide and 6 micrograms of formoterol. So with this, the ongoing research will definitely give more insights and we'll be able to push that medicine as a recommendation as anti-inflammatory reliever therapy, in step 1 and step 2 management of between 6 and 11 years of age. I'm very optimistic about it. I'm not saying it will come, but I'm very optimistic. With this, I'm going to stop my rant for the day. Thanks for tuning in. If you have tuned in, like, subscribe, and share this video as much as you can.